Section 5, Clarity. It is important for you to be able to describe your innovation well so that you can communicate it clearly and succinctly. You will have a good understanding of the problem or problems that your solution can rectify from the value proposition. In this section, we will explore tools that can help you develop clear messages and that will help you engage and spread your idea more widely. To begin with, there are some basic principles to follow when communicating your innovation. Number 1. Focus on the problem that you're solving. Explain clearly the problem that your innovation will tackle. Why is it important? Who does it affect? What are the consequences of the problem? Number 2. Tell it from the end user's perspective. Frame your problem in a real-world narrative that brings the subject to life and makes it relatable. The simplest way to do this is to tell it from a patient or service user's perspective. How does it affect them? What situation does it cause? Number 3. Focus on the why and then the what. It is usually better to describe why a solution is needed before describing what it can do. When communicating in this way, we spark empathy, and it is more likely that people are inspired to action. The 3-30-300-second rule diagram helps you prioritize and structure information so that you can share it more effectively. The idea of the model is to organize and present your information in 3 tiers. Each tier represents the amount of time needed, as an estimated rule of thumb, to read or process that information. So the first tier, the 3-second tier, this is your top-level message or headline. It could be a short sentence, statement, quote, or even a diagram or picture. It is your main message, and less is more at this level. The next tier is the 30-second tier. Now this is your elevator pitch. The best innovations offer novel solutions to challenging problems. To influence people who can turn your idea into reality, you need to deliver your pitch in an exciting and straightforward way. So, when you're asked what your innovation is about, be ready to have a clear, concise, and engaging answer. Why not send your elevator pitch to high influencers in your organisation, inviting them for comment? What have you got to lose? The final tier is the 300-second tier. This is where you would provide all the detail. It would contain data and evidence to explain and support your main message. It should build upon your argument objectively. Here you would provide concepts and insights that help others explore your idea. It should be accessible and readable for those who like to have data and evidence. It's a really good idea to test out your 300-second pitch with colleagues and family members. Ask them for feedback so you can improve it. Creating great presentations about your innovation requires you to consider the right mix between data and narrative. Here are some tips you can consider. Number 1, frame your story. Humans are wired to listen to stories and metaphors, and they work best to engage people. We crave meaning before data. Number 2, figure out where to start and where to end. Consider what your audience already know and how much they care about a topic in advance. Number 3, explain why you care so deeply about your innovation. This will help convince your audience to care too. Number 4, share documents in advance or after with more detailed data and information. Number 5, don't cram in too much. If you try to include everything, you won't have time to get key messages across. And number 6, avoid using lots of text. Use mixed media, photos, illustration, and data visualization. These are really engaging to the audience. Get your voice and ideas heard where your stakeholders hang out. Identify the spaces where you can communicate and network with people who are able to influence spread and uptake of your innovation. This might be at conferences or events and even online discussions. It might also be at key meetings in your organisation. Find out how the governance works and who you need to talk to in order to get a slot on important agendas. Number 2, create social media platforms for your innovation to reach a wider audience. Social media is an excellent way to access local, regional, national and global audiences. By creating an online presence, you can get your voice heard and more widely. If you're not confident in using social media, just start by exploring. It's okay to observe and not contribute. See if you can find people who are also working in your field or area of expertise on Twitter or Facebook and see what they're saying. This might inspire you to join in the conversation. There are some rules to follow when using social media if you're a health and care professional. Most professional bodies have produced guidelines, including the Royal College of Physicians and the Nursing and Midwifery Council. Share what you know already and be open to debate. By sharing your idea, you will be, de facto, inviting comment and debate. See this as valuable data to inform and iterate your idea further. Build or join networks to share, gain opportunities and learn. Connecting with other people working in healthcare, industry and academia provides a great opportunity for you to learn, and it opens up opportunities for spread of your idea. Find your tribe, face-to-face and online, to build and maintain resilience. Being an innovator can be tough. You will face knockbacks and barriers, so seek out like-minded people who are facing similar challenges. Your tribe will support you when things aren't going well, offering practical help and advice. If you're a clinician and an innovator or entrepreneur, you may want to think about joining the Innovation Agency's Scouts program, for example.